The term population health is a really good way to think about public health, or the health for a public or a group of people. One of the reasons I chose to go into public health is because I was really interested in how I could affect the lives of my patients, and more than just the 15 to 20 minutes I had with them in clinic. The social determinants of health are a unique way to look at health, not so much from a medical perspective where we are kind of diagnosing and prescribing. The social determinants of health is a really holistic way of looking at health. So how do things outside of traditional views of health and medical care affect someone's health? Looking at things like transportation, where someone lives. People say your zip code can affect your health just as much as your genetic code, if not more. And so we think of ways that we can impact someone's environment and impact and improve the social determinants of health. As we think about how we're going to improve the health of populations or of different communities in Pennsylvania, we think a lot about rural health. So when you think about a community that has a high rate of obesity, whether in children or adults, you want to make sure that they have green places to play and live, meaning time that they can spend outside and that those are safe and accessible. You also want to make sure that people have the ability to access programs. So if there's a really great after-school program but it requires someone to walk there, you want to make sure that there's a sidewalk from the school to wherever the children are trying to get to. We also think about workplace wellness in Pennsylvania, and so we have a program called WalkWorks, which we're currently partnering with our colleagues in the Department of Natural Resources and Preservation, and thinking about how we can ensure that there is a trail within kind of 5 to 10 minutes of every hospital. As I went through residency and I was seeing my patients in the clinic, I realized there were so many other things that touched their lives other than me for that 15-minute visit. And that's really what really continued to spur my interest in public health. How do I improve the community that I live in, and how do I improve the community of my patients so that when they're coming to see me and I need to refer them for resources, the community is there ready to kind of step up to the plate to fill the holes that I can't fill. I really love the work that I do. I called my mom on my second day on the job, like, Mom, this is my dream job, which is great because when I'm having the day that doesn't feel that way, my mom can remind me of how I felt on that second day. I'm always learning in this position, and so while I look forward to continuing to serve, and I don't know if that'll be in public service or in the nonprofit sector, for now I'm just so filled with the work that I do that I can't imagine kind of not ever serving. And so I think as long as I'm able in one part to see patients and continue my work of service, and in another aspect of my career, I think I'll be fulfilled.